Hello again. This webinar is about transverse dimension. We are going to discuss why should we care about it, how to diagnose a transverse problem, how to solve the problem, and also we are going to discuss on mini implant assisted expanders. On general examination, what do we look for? We are always looking for class, okay, for sagittal. Want to know what class is the patient in. Class 1, is it class 2, is it class 3? We really want to know our sagittal. Then also we want to know our vertical. We want to know about overbite. Do we have the patient with an deep bite or we have a patient with an open bite? And excepting obvious cases with cross bite or scissor bite, how often are we really looking at the transverse situation of our patients? Even when we do X-ray examination, what do we look for? Most often used X-ray in dentistry is the OPG. So we're looking at the status of the bone, status of the teeth, we approximate the TMJ situation, we're looking for infections, tumors, and even if we do Ceph, usually what type of Ceph do we do? Usually we do lateral Ceph, and in this Ceph what we can see is sagittal and vertical also. We want to know, is it a high angle or low angle case? We would like to know our incisor position, cervical spine, airways. So all of these informations are centered to sagittal or vertical dimension. How often do we ask for PA-Ceph or CBCT? Luckily, these days CBCT is used more and more in dentistry and it's more accessible, and due to the CBCT we have more information than ever and they are more precise than ever. But even if we take a CBCT, what do we look for on the CBCT? Are we looking where we have to look, where we should look, or we are just looking and maybe we are going to see something there? And then the patient come into the office and we look into the mouth and we do the intraoral examination and we see that there is no crossbite and we say, okay, we are good, we are okay in transverse dimension. Are we really? If you take a more careful look at your patients from the front and you look on the transverse dimension, sometimes you will ask yourself, is everything okay there? Or maybe there is a problem. If we are in class 1 and the teeth are not flared out, most probably transversally we are okay. That usually means that the curve of Wilson is in limits. How can we assess curve of Wilson? It is really easy. Take a look to the palatal cusps, and if they are not lower than 1 millimeter than buccal cusps, curve of Wilson is in limits. If you see hanging palatal cusps, curve of Wilson is too accentuated and most probably our patient has a transverse problem. For good results and stability, it is necessary to have a functional occlusion. That means you need to have occlusal stops and proper guidance. Canine guidance is imperative for functional occlusion, not only to produce disocclusion of the other teeth, but also for its proprioceptors that is keeping under control masticatory forces. When we have hanging palatal cusps, interferences on non-working side occurs and occlusion becomes dysfunctional and it will try to adjust itself. This is the most common cause for relapse, gingival recession, bruxism, so on. In class 1, active centric line and passive centric line should correspond. In class 2, due to a sagittal situation, we most often have camouflage transverse discrepancy. In occlusion, in maximal intercuspation, all looks nice. But if we take cast models and try to put them in class 1, we can observe sometimes that in transverse it is going to result in cusp-to-cusp occlusion. This is a sign that we have transverse discrepancy, and in order to have good functional occlusion at the end of treatment, we need to do some sort of expansion. If this expansion is going to be dental or skeletal, it remains to be determined. Article published in Reviso Journal, September 2010, by Dr. Ryan Tamburino. It is a must-read article when transverse dimension is discussed. In this article, whys and hows are explained as clear as possible. So I recommend you to take and read this article in order to make it easier for yourself later. Recent studies show that the elimination of working and non-working interferences enhances the long-term periodontal prognosis in patients susceptible to periodontal disease. Also, there is a relationship between a constricted nasopharyngeal airway and a narrow maxilla, which leads to change in posture with head in forward position and tendency to class 2. Expanding maxilla not only increases airways, but will also help in correction of the patient posture. So, periodontal status, stability, bruxism, airways, and skeletal and functional envelope are all reasons why should we care about transverse dimension. If we recognize early a deficient maxilla, we can avoid situations like this.